don't have to be scared of carbohydrates, but the quality of the carbohydrates is very pertinent. So focusing on wholesome foods, like you see there, fruits and vegetables. You see lots of beans and lentils. You see whole grains. That's the type of plate you should be eating. You don't have to focus on macros, but you have to focus on foods which are naturally dense in fiber and the nutrients that comes with that. Eating 6 small meals a day is not optimal. You've been told, or you may have heard, or you may have read it on the internet, if you have diabetes, you should be eating small meals frequently. 3 meals, well-planned meals versus 6 meals a day. And your blood pressure, your weight, your BMI, your sugar numbers all do better when you eat properly, but enough at a meal and less times a day. So it is very important to focus on the quality of the food and also the frequency of the food intake. Well, the issue is when you eat foods which are high in fat and protein, especially animal protein, you will find that you create more insulin resistance. So trying to make sure that you eat in the middle of the day majority of your calories. One good timeline that I usually try to follow and tell my patients as well is eat between either 8 a.m. to 10 a.m. depending on your schedule, up till 6 to 7 p.m. As Ayurveda always says, if the diet is wrong, medication is of no use, and if the diet is correct, then medication is of no need. And Hippocrates has always mentioned that we have the strongest and the greatest healing power and force in the world. Our body has that capability. All we need is to give it the right environment.
So there are 8 risk factors of diabetes. Some of them were talked about prior. As we get older, maybe above 40, you could be even younger, more the inactive lifestyle, your high cholesterol, high blood pressure, a BMI above 23. And I'm saying this 23 is because Asian Indians are considered obese at a lower BMI as compared to Caucasians. So even if you were to be 25 or 26, you would be considered obese. And so you want to have a very low BMI. Your family history, of course, is something that you really can't change, but you can change all of the other factors that are right here. Exercise is a big component that will help you to bring down diabetes and pre-diabetes.